Hello and welcome to the Third Sector podcast. I'm Lucinda Rouse.
And I'm Emily Burt. Each week we bring you half an hour of discussion and debate about the important goings-on in the charity world. This week we'll be exploring mental health issues in the voluntary sector and how organisations can support their staff, volunteers and service users in this area. And later, in Charity Changed My Life, we'll head to Uganda to hear how training provided through the charity Feed the Minds has changed one person's life for the better.
But first, going straight into our main discussion this week. Many charities in the UK offer mental health support to their service users, either as a core component of their service offering or as part of a more holistic package of support. But how about people who are working within those charities? As working environments become increasingly pressured with fewer resources to deal with greater levels of demand, how can organisations support the supporters? We heard from Samaritan's Chief Executive Julie Bentley on this podcast last year about the reflective practice support they have introduced to support staff who are exposed to difficult content at work, and also its use of mental health first aiders. And just this week, Prince Harry has made headlines by calling for a rebrand from mental health to mental fitness, which strikes me as quite apt timing considering our subject today. We're joined by two guests in the studio who are probably better placed to comment on Prince Harry's rebrand. First up is Alicia Nagar, who is the Head of People, Wellbeing and Equity at Mental Health First Aid England and the Association of Mental Health First Aiders. Hi, Alicia.
Hello, good to be here.
It's great to have you with us. And also joining us is Sam Stapley, who is the Chief Operations and People Officer at Trussell, formerly known as the Trussell Trust. Hi, Sam.
Hi, Emily. Good to be with you.
Are you getting used to that name change yet?
We are. Of course, this is something behind the scenes we've been working on for a while. So although it's been unveiled in the last week, it's something that we have been getting used to.
So Alicia, Mental Health First Aid England works across all sectors, public, private and voluntary, and many different industries. But is there anything unique about the challenges faced by third sector organisations and the people working within them that's perhaps different to the challenges that other industries might encounter?
Yeah, I think there definitely are. We know from research by Deloitte, for example, that mental health cost businesses 45 billion, they said, in a report in 2022, and then it went up to 51 billion in 23-24. So we know that it costs all sectors a lot of money, and there's a lot we can do. But specifically for the third sector, I think there are unique challenges. For example, a lot of people that work for these organisations, a lot of our employees, they are values-led, and they're there because they want to make a difference. They're really passionate about the cause. And I think that brings with it its own challenges. You see a lot of discretionary effort and a lot of getting your whole self in there. And I think that can lead to challenges such as, we know there are high rates of stress and burnout within these sectors. Lots of research suggests this at the moment. So they definitely need support just as much, if not more, than other people. I think also, service users often are vulnerable. So they're out there supporting other people, not just their colleagues. So to be able to have constructive conversations around mental health out there with service users is really important too. But also, the stress that can bring onto the individual. We're all human, and just because you're doing your job doesn't mean that's not going to have an impact on you. So I think those are just a few points of why it's so important to provide mental health support in the third sector.
And you at Mental Health First Aid England, the clue's in the name, you
Absolutely.
Provide support through mental health first aiders within organisations. Can you just give us a really brief rundown of what that is and what those first aiders do?
Yeah, of course. So, most of us will be familiar with physical first aid. So it's not massively dissimilar to that. It's having people within the organisation who are equipped to deal as a first response with people who, need support with their mental health rather than their physical health. So it builds confidence in the individuals, gives them the tools and the skills to be able to have those conversations. It also helps to reduce stigma in the organisation. People have that kind of literacy around mental health and can champion mental health support and conversation out there as well. So yeah, they're not qualified, they're not counsellors or therapists or anything like that. Obviously that takes years and years of medical school to be qualified in those areas, but it's somebody that can be there in the moment to provide a conversation, to have that support and be able to confidently signpost to other places if that's appropriate as well. At Mental Health First Aid England, our mental health first aiders are supported throughout their journey as well. So they have the training, but then afterwards they're supported through an app. We have ongoing CPD such as webinars, so they're supported as well. And I think that's also really crucial when having mental health first aiders in an organisation.
And I'm sure everyone listening to this will know and will be very aware that the current environment for the voluntary sector is particularly challenging at the moment. So you mentioned there the challenges that broadly voluntary sector organisations tend to see in their work, being values-led, stress and burnout being very prevalent. That is something that certainly we know is a long-running issue in the sector. But we're also seeing very immediate challenges as well as a result of the cost of living crisis and that kind of rolling state of crisis that we've seen since COVID-19 kicked in. And I know that for Trussell particularly, there has been soaring demand in recent years. We've covered that extensively. Sam, I'd be really interested to know, how are you seeing the current challenges that face the voluntary sector affecting mental health needs within your own organisation, perhaps more broadly as well?
So, as you know, we are an anti-poverty charity and a community of 1,400 food banks across the UK. And we work together to make sure no one needs to use a food bank. But as we all know, we have seen soaring levels of need. So in the last kind of financial year, across the UK, we saw 3.1 million food parcels being provided to people accessing food banks. And that's a 94% increase over the last 5 years. And what we know is that people experiencing mental health conditions are very closely tied to, financial hardship. So the two of them go hand in hand together. We know that 56% of people who accessed a Trussell Trust food bank reported having mental health conditions and financial hardship as well. And those two factors are reinforcing of each other. So we know that at food bank level, that need coming through the door is creating immense pressure on the staff and volunteers at those food bank centres in those 1,400 communities. And that is creating stress and anxiety, and people coming through the doors are also very stressed, very anxious about their financial status. We know that of those people reporting mental health conditions, there's something like 65% of them have not been able to access any mental health support in the previous 3 months either. But aside from the staff and volunteers across the network, our own staff, we are seeing a small increase in those who are reporting sickness through anxiety, maybe some stress, a bit of depression. It's still only around 10% of the kind of sickness absences, but it is something we're really attentive to. And we are also looking at things like mental health first aid training. So at the moment, in terms of our own central staff, we have all of our senior level heads and directors have been trained in mental health first aid, 27 last year, and that's a rolling programme now in the organisation. And across the network, we are also offering mental health awareness and champions training, and there are something like 168 people trained across the network at the moment, representing about 97 food banks, and that again is a rolling programme of work across the network as well. And we're also in discussions with Mental Health First Aid England on line manager specific training. So how to approach some of those one-to-one conversations with direct line reports where they are feeling stressed or anxious.
And is there a difference, Alicia, in terms of the way that charities respond to, for example, their staff and their volunteers? You have a different type of responsibility contractually to your staff than you do with your volunteers, where often you don't have any contract at all. So with the charities that are involved in the mental health first aid scheme and programs, is there a kind of differentiation between the two?
Yes and no. I think you do have a duty of care as an employer to the people that you employ. So obviously that is slightly different to the care that you give to service users or people that might be involved with your charity or organisation from a different perspective. I think one of the key things is for employees, we would never say mental health first aid solves all the problems. It should be part of a wellbeing strategy. I think it's a very important part of that strategy, but there should be other supports out there as well. Where are you going to signpost people to? Have you got an EAP or have you got other services? Those kind of things. In terms of the core of mental health first aid itself and the program and what we train people to be able to do, it takes a person-centered approach. So actually those conversations you're having, whilst you might be signposting somewhere different, or you might not be able to maintain check-ins with that individual if you're not seeing them on a regular basis like you would if they were a colleague, for example, the conversation itself shouldn't be all that different, really, because actually you're having a one-to-one conversation with an individual that's led by them about their mental health and about what they need in that moment. And so actually the conversation itself, I wouldn't believe massively differs, which is why it's so important to be able to have those skills. And we do find people just use those skills in their everyday lives. You know, it's not necessarily just in the workplace or just with service users as well. You know, it's about kind of, you know, being able to have those conversations with all people that you come across. So I don't think in that respect it's massively different, actually.
Just picking up on what Alicia was saying just then about kind of the one-to-one conversations. You said, I think, how many people was it working across the Trussell Trust network?
So I think it's important to establish that as an organisation, we have 340 central staff that we directly employ, but we are a second-tier organisation, so we support 1,400 food bank centres. So there's both staff who are employed in those centres and around 36,000 volunteers.
Yeah, absolutely. So it's an enormous network. And I mean, even having more than 300 directly employed staff is a really, really big number, let alone that much wider network. So how do you manage getting those messages out and making sure that you're sort of not only, you know, offering that support to the people that you directly employ, who you have that employer responsibility to, but also, you know, is there indirect support that you are able to offer out guidance to the food bank network as well?
Yeah, so we do, I think, quite a lot, but we are always, you know, looking to do more. But when we think about our own central staff, I think I completely agree with Alicia. We're looking at, it's a whole approach to the person. It's not just about, oh, here's some mental health training. So we have things like employee assistance programs. We have healthcare cash plans that allow people to access GPs and counselling support if needed. But we also have really quite good flexible working policies. We have safe space groups. We have a group of wellbeing champions as well as mental health first aiders. We also have an intranet where we can signpost our staff to general wellbeing resources. But I think more than that, we try and keep a really good sense of what's happening across our organisation. I think it can be easy, especially in these remote working environments, to forget how things used to be when you were all in an office together. And so when you're virtual first, we know that some of our staff are perhaps beginning to feel slightly isolated, and that sense of community can be lost unless you're being super attentive. So we spend quite a lot of time on things like one-to-ones with line managers and encourage those to be done on a monthly basis and at least quarterly in person. We have in-person staff conferences twice a year and also directorate meetings that bring people together. But we also have a weekly all-staff call where people can see each other. So it might be led by one person hosting the call, but everyone feels a sense of community. And we regularly have close to 200 of our staff are dialing in. So we know this is something that's quite popular. And aside from all of that, we do staff engagement surveys. So we do them perhaps more frequently than other organisations. So we do these every 8 weeks. But what it means is we can keep a very close eye on where things might be areas that we need to focus on. But we know that our staff engagement is very high, and things like peer relationships and that sense of community are high. And our management support is also currently scoring very highly. So these are things that we are constantly looking at as a senior leadership team to ensure that we don't become complacent because we can't see each other in the same way. And we have also just recently done some work with the Wellbeing Project around kind of wellbeing and resilience, and looking at that in 5 pillars of how people are feeling. So we're crafting our wellbeing strategy to move forward from there. We do offer quite significant elements of training. So we're also looking at things like a wellbeing community of practice that we're about to launch, working with some of our front-facing staff in particular, and bringing them together to look at having a series of sessions which might include things like self-care, self-compassion, building a healthy work-life balance, and seeing how that works, and then rolling that out as a community of practice across the organisation. When it comes to the network, then we have a digital hub where we have lots of resources around health and wellbeing. We will also fund counselling sessions by a grant if that's required for any of the staff or volunteers across the network. But as well as the mental health awareness training that we supply, we also are looking at how to debrief as groups through the Samaritans, and that training is being rolled out across the network, along with how to have conversations with vulnerable people, de-escalation techniques, because we know that there are incidents of aggression perhaps coming through at food banks because people are very anxious and very stressed, and that manifests in different ways. But also managing suicidal conversations as well. And what does that mean if you're a front-facing member of a food bank? Supporting you to support others is another area we're looking at. And we're also doing some work around personal safety as well for volunteers and food banks. And all those are offered on a free of charge basis. So we fund that directly at Trussell.
And it was interesting what you were saying about the difficulties that people working in the food banks are facing in terms of their encounters with food bank users and the stress that they're under. I can imagine that there are different needs depending on what roles people play. And obviously the Trussell Trust is by no means alone in the charity sector. You've got management who are going to be under significant strain and stress when the demand goes up, particularly if the resources are going down, as is the case in many charities. But then when you've got that frontline interactions, are the needs of those two groups different? And do you have to provide support in different ways, or do you find that it's sort of a one-size-fits-all holistic approach to supporting people's mental health?
So I think it is different. So depending on whether it's volunteers or staff who are actually meeting with people that are being referred to food banks, their needs will be quite different, maybe to somebody that might be sort of still within that food bank environment, but maybe a step removed. So maybe a trustee of the food bank, or somebody that works more perhaps in a back office function rather than sitting directly in front of people referred. So there are differences. At the moment, we're looking at how some of the training rolls out and the uptake. But what we're finding is we're oversubscribed. So we are already looking at how do we put more courses on. But we also try and offer peer support groups through cluster meetings online to enable people to come together, and similar things for trustees. But there are different challenges. So we know that over the last few years, food banks have had to buy more of their food as the need has increased with people coming through the doors. The funds and the amount of donations have gone down, particularly in some areas. And so finding the funds and ensuring that they can plug the gaps of the food is creating different stresses. So we are looking at different ways of supporting, and that might take different things from running different courses to actually how do we step in and more directly support them to think about how to raise donations in their local areas. So we're constantly alive to the changes in the network and what that means. But the knock-on effect to our central staff, we're finding more and more people are contacting us directly. So our network support teams are answering the call to the public who are seeking support. And so some of the challenges internally are increasing on some of those more front-facing teams that historically wouldn't have been front-facing in the way of being in a food bank like an area manager might be, but are like our stories teams, our research teams, hearing the stories constantly. So compassion fatigue, de-escalation, again, debriefing, all of these are courses and training and support that we're implementing for our staff centrally.
Now, that's a really interesting picture there from Sam about how that escalating need at the service user level then creates constant knock-on impacts, whether it's at regional levels among volunteers, coming into directly employed staff, and all the way up to line managers. And I think that's something that will resonate with a lot of charities, because resource ultimately is a huge issue. It's amazing to hear that Trussell is directly funding support that's able to go out to its regional food banks. But Alicia, I'd like to ask you, how do you think, charities can improve the mental health support that they provide, particularly if resource is a problem for them? Because there are going to be people at every level of these charities who are struggling bluntly with fatigue and with burnout themselves, and may not have the budgetary resilience to kind of offer tailored expensive support. So what can these organisations do, considering that so many of them are on a shoestring themselves?
Yeah, and obviously this is one of the challenges of the sector, isn't it? As you say, resource, and with the cost of living and everything else, that's only becoming even more prevalent now. And yeah, definitely agree. It's brilliant what Trussell are doing. They're definitely a good example of what support you can provide, but not everybody's going to be in that position. I think, first of all, if you have things like mental health first aiders, they have access to a lot of resources through the app, so they can signpost people to services that are free of charge. So charities and reliable places and other support services out there, they can help to find that. Obviously, they can also be that first point of conversation. If you don't have that, or if that's something you're still working on, or even to supplement it, on our website, we have lots of free resources. So, for example, we've already pointed out how important managers are. That, part of what we say in our mental health first aid training is that spotting the signs and symptoms and being able to have those conversations is really important. And line managers are perfectly placed to spot those signs and symptoms if they've got effective relationships with the people that they manage. So, having those one-to-one conversations. Sam was saying how at Trussell, they're built into the business as usual, which is so important. As part of our My Whole Self resources, which you can download for free of charge from our website, we offer like a pro forma of a structured conversation that a manager could use in a one-to-one, and it begins with a conversation about well-being. How has that person been doing? It's a very general conversation around their well-being, not just about work. And then it goes into, is that having any impact on your work? And then you talk about all the KPIs and objectives that you've set for them and all of that kind of thing. But it does start with that conversation about well-being. So managers are so well placed to be able to do that. And I said there's free resources around that on our website. We also touched on suicide prevention earlier. Sam was mentioning we've got lots of tools on our website around that. It was World Suicide Prevention Day a couple of weeks ago, and we released a toolkit for that. We also ran a webinar for our MHF aiders, again, upskilling them, and we had over 2,000 attendees to that. So, people are really open to learning more, and I think that's so important. But yeah, for organisations who are a bit stressed, there's lots of free resources. I can talk about what we offer, but that we're not the limit. There are other good, reliable resources out there as well.
Yeah, it's all about fostering that culture, isn't it? Because you can put in mental health first aiders, but if there's mistrust, distrust at the organisational level between management and staff, particularly if it's an organisation that's under pressure, as so many are at the moment, then you might not get people going forward to take that support that is offered because they may feel that it may have repercussions for them. So yeah, the importance of managers in opening conversations, initiating conversations, and promoting that culture of openness and support.
Absolutely, yeah. Culture is so important, and leaders need to lead by example on that. So yeah, leading those conversations, but also being transparent, about mental health, talking about maybe sharing their own stories if that's appropriate. That kind of thing can really help to change the culture and reduce the stigma around having mental health conversations. Mm. And then in turn, obviously, that encourages people to ask for the support that they might need.
Yeah. Sam, you laid out this very impressive suite of different services and different forms of support that you provide at Trussell. And it is an interesting organisation because you've gone through such a huge period of growth over the past 10 years or so. I was wondering if you could give us any insight into things that have worked particularly well and any that perhaps haven't worked so well that you've decided to leave behind when it comes to staff wellbeing and how you support that.
So I think we have grown dramatically, I think, since COVID. So we went from 100 staff as we went into COVID, and we're now at 340. And so we have done that whilst being virtual first, which was obviously a massive learning curve for all of us. I think that some of the things that we were super attentive to were our values and our ways of working, our culture. It's really, as Alicia said, it's really critical. And expanding quite rapidly, and whilst we're all online, has meant that we have had to be very attentive and make some quite intentional choices. So things like our all-staff call and having all staff Q&A sessions where people can ask whatever they like, where we bring staff together to have open conversations, where we're very transparent about any of the challenges we're facing. So I think all of those were really important for us. And also, I think the one-to-ones were very important, and the analysis of our staff engagement tools. I think that some of the things, when I think as well about the network, hearing about some of the themes as they come up has meant that we've had to be quite agile and adapt very quickly. And I think that is something that we do well at Trussell. But maybe we implemented, for example, a scheme, BHSF Rise, which is always quite a tricky one to say. But we offered that as the food banks were going through a particularly tough time around a cost of living crisis sort of last winter. And that was access to online support and counselling where people could contact that. And actually the take-up was far less than we'd imagined it would be. So sometimes we implement things and then we're kind of keeping an eye on it. That hasn't worked. So what we've done is we've changed that to counselling services we will grant fund if needed across the organisation. So I think all the time we're trying to learn, and everything we implement, we're trying to get feedback on who's using it, is it valuable, do we need to change it for something else. I would say that many of the things we've implemented around support have been wrong, but I definitely think there are some things that have proved more useful than others. And I think we're now seeing a time that we're moving into more compassion fatigue, and I think people feeling very tired, very anxious about this, the fact that this is just continuing. So these are the areas that we'll be pivoting more into, I think, over the coming 6 months or so.
I think definitely what you're saying is really resonates with me, because I think trying things out is really important. And it kind of goes back to your earlier question around what you can do on a shoestring. And actually, there are lots of things you can do on a shoestring, but try them.
Absolutely. And I think another thing just to add on there for charities, which you said, try things, be brave enough to stop things as well. I think particularly when it comes to mental health offerings and when it comes to wellbeing offerings, you can try things and then you feel a reluctance to wind them down if they're not working, because it feels like you're taking something away. But as we say, at a time when resource is so tight, actually it's a much more helpful thing to say, okay, do you know what we really need to focus on now? Compassion fatigue. This is what everyone is going through. And so we're going to sort of take the pedal off this area in order to prioritize that. That's not you being a bad employer. It's not you being a bad line manager. That's you sort of recognizing that evolving need, which is always going to be changing. I think that's something that charities can sometimes struggle with, is knowing when to let go, as well as knowing when to sort of try new things.
Yeah, and that definitely resonates. So I can remember there were a number of conversations about, do we stop the offer of BHSF Rise across the network? And it took us 2 or 3 months to make the decision. But the reality was it wasn't being accessed as often as we had originally thought it might be. And so we made the decision to switch the offer, and it was the right decision to make. But it did take us a while to say, I think we need to change this.
I think that's also where it also comes back to good communication and good culture, and being able to feed that then down to the employees and say, look, this is what we've seen, therefore this is what we're going to do. Tell us, give us feedback if that's not the right thing, and let's work on this together. Yeah,
and it sounds like Trussell are doing a brilliant job of creating lots of opportunities for feedback. So I think that's another thing that doesn't cost too much that third sector organisations can definitely do.
So as a final parting question, given the amount of work and the amount of time that you both spend considering these issues and how you can better support the mental health or mental fitness, as you may want to call it, of the people who work for you and the people who access your services, if there's a charity which has recognised we need to be doing more, our people are really struggling, what's the number one piece of advice that you would have them on embarking on that journey of improving their offering, perhaps based on anything that you've really learnt over the past few years?
So I think that one of the critical things for us has been to actually listen to what it is your staff are telling you. And I think sometimes as senior leaders, we can be in danger of making some assumptions about what people might need. And so I think for us, actually having what we call our safe spaces, others might call an employee resource group, a staff council and trade union that we recognised last year has been really helpful, but also feedback from people's one-to-ones and also what our staff engagement is telling us. So by analysing what are the people telling you, I think helps you to make some really good decisions rather than making your own assumptions.
Alicia, would you add anything?
I think Sam stole my answer, to be honest. But yeah, there's no one size fits all approach to this. Every organisation is different and your employees are going to be different to the next group of employees. So listen to them, but also keep doing that, because again, you will listen to your employees, but in a year's time, they might need something different. As we said earlier, if something isn't working anymore, you can also take it away. So, keep listening, keep that dialogue open and create different channels. So, as Sam said, there's the surveys, but there's also one-to-ones. There's also, these group spaces where people can have conversations. I mean, we have an in-person meeting every month for all of our people, and we often create opportunities on a specific subject where people can feed back during those sessions and have conversations. So there's so many different ways in which you can get that information. We have an annual employee survey, but we have pulse surveys to supplement that throughout the year. So, what can you do to create those channels of two-way communication and keep listening and keep evolving and stay agile?
Fantastic. Alicia and Sam, thank you so much for joining us today.
Thank you.
Thank you.
We hope you enjoyed our discussion with Alicia and Sam. And now we move on to Charity Changed My Life, in which we bring you the stories of people whose lives have been transformed for the better thanks to the work of charities. This week we head to the Amalata district in northern Uganda. We're going to hear from a member of a women's farming group. She received training from the Ugandan NGO ACSET Uganda with support from the UK-based charity Feed the Minds.
My name's Opinya Lilly Okello of our village, Etam sub-county and Amalata district in the country of Uganda. I'm a member of a marketing farmers group. We are doing vegetable growing through kitchen gardening, and we are saving at the same time. We started last year in January 2023. The first benefit we received was training. The first training we did was in vegetable growing. We started with one kitchen garden per home, but as I talk now, I have 3 kitchen gardens for myself, which is serving my family and the community. And the second one we were trained in financial literacy, record keeping. We have adopted the saving culture. We were trained about putting in the business plan before you start the project. You have to plan, indicating what you are going to do, the marketing plan, the business idea, and as compared to before the project, I knew nothing about business plan. But now I can do it myself before starting a project. At the end of the project, maybe next year, I'm planning to have a motorcycle, which will help me in transportation and marketing of my product like poultry and veggies. Because at the moment, as I talk, according to the training I got, I've started poultry project, which will boost my income and help my family members. Because if you have money, you are able to do everything possible for you.
That was Opinya Lilly Okello explaining how her involvement with a project run by ACSET Uganda and Feed the Minds has changed her life for the better. And if you'd like your organisation to be featured in Charity Changed My Life, we'd love to hear from you. All it takes is a short voice message from someone who has benefited from your services, and you can find details of how to get in touch with me in the show notes to this episode.
That's it for this week. We'll be back again next week, but for now, thank you to our guests Sam and Alicia. Our producer is Navpal.